Carpal tunnel syndrome is a condition where the median nerve, one of the three nerves to the hand, is pinched or entrapped beneath a structure called the transverse carpal ligament. Now, the transverse carpal ligament is a ligament that's about as wide as two fingers, and it goes across this part of the wrist. The median nerve goes underneath that ligament. And so treatment of carpal tunnel surgically is to go in and divide that ligament so that the nerve will have more room. I often show patients in the office this analogy. If this is your carpal tunnel and the nerve goes through here, if these fingers at the top make up the transverse carpal ligament, we go in and we divide this ligament and it lets the wrist open up a bit. And so by simply dividing this ligament, the transverse carpal ligament, the nerve now can have more room. It gets better circulation, and that's the treatment of carpal tunnel syndrome. Now, the surgery can be done in a number of different ways. Here at Franklin Orthopaedics, we do it endoscopically, which means we just make two little puncture wounds in the wrist and the hand. So I have one little puncture here, I make another in the palm, and then I have a scope, kind of like a scope that we would use for a knee or a shoulder, except smaller, and we pass that through the carpal tunnel. We look at the transverse ligament and we divide that ligament through the scope. And so at the end of the day, it's really Band-Aid surgery. You have two small incisions. It's done as an outpatient. You go home that day. We always equip patients with mild, well, with perhaps more than mild, with narcotic pain medication if that should be necessary, but most people don't need pain pills for very long. The stitches are in for about a week and a half. It's okay to gently begin light use of the hand as tolerated. I always write for physical therapy to help empower people to avail themselves of that option. Most people can regain their strength and their range of motion on their own, or perhaps with a little help from PT as well. With respect to post-op activity, it's okay with me for you to be as active as your hand will let you be. I'm a big believer in listening to pain or swelling and let those symptoms guide our activity level. But most people are back using their hand at least in a light fashion within a day or two. Long term, the recovery of the nerve can be days, weeks. Sometimes it takes months to get as good as one might get. And so if one were to have a little lingering numbness or tingling post-operatively, I counsel people not to be too worried about that, because sometimes it does take time for someone to ultimately totally recover from carpal tunnel syndrome. It's really rare for someone to have recurrent carpal tunnel syndrome, but it's not totally impossible. Most of the time, these are patients that have recovered so well that they go back to a really strenuous activity or work environment. Again, most people don't have recurrent carpal tunnel, but it is possible on rare occasions to have a recurrence, and sometimes additional conservative or surgical treatment might be indicated.